So vascular surgery is the most technical surgery I think that exists, which is why I like doing it. Every case is different. It requires custom planning from the thought process that I generate for the case plan while incorporating advanced three-dimensional imaging and post-processing to look at people's anatomy to come up with solutions to treat them the best. So it's what makes vascular special. Gallbladder surgery for people, it's the same every time you do it. If you take out a uterus, it's the same thing. You take the uterus out. But vascular surgery, there's so many different intricate things that to generate a customized, personalized plan of care to provide the most long-term durable result requires a lot of thought. And that's why I like vascular surgery. And vascular surgery is a lot. Vascular surgeons typically do carotid surgery. They fix blood vessels that cause strokes in the head. We also treat basically any artery outside of the heart. Includes the kidney arteries, the gut arteries, and then the blood vessels that feed the legs. Not only that, we are the firemen of the hospital. So when somebody has a bleeding issue and somebody's dying, we are the people who come to help other surgeons fix those problems. So we're kind of the last line of defense. One of the unique things we brought here recently by me coming here was the ability to do a little bit higher tech, less invasive bleeding saves by doing embolizations. In fact, a recent patient we had open heart surgery, and several months afterwards had a little bit of a leak around their aorta. And traditionally, this would require a reduced sternotomy, which is to recrack the chest in a reoperative surgical field, and a high bleeding risk problem, which would probably take 6 to 8 hours to fix. And I saw that patient and came up with a case plan, and we fixed that patient in 15 minutes through a wrist puncture. So we've expanded the capabilities of vascular surgery here, not only from a breadth and depth standpoint, but since I've been here, we've also expanded what other vascular physicians are doing. Meaning, I've been side by side with the surgeons in the hospital to help teach new techniques to provide care not just from me, but for other vascular surgeons in the area. So we're treating more complex disease at the hospital.